Our bodies are complex machines, and sometimes the things we put into them can have unexpected and dangerous interactions. This is especially true when it comes to mixing medications and alcohol. While many people are aware of the dangers of mixing alcohol with drugs like painkillers, fewer are aware of the potentially fatal consequences of combining alcohol with certain psychiatric medications, specifically antipsychotics. Antipsychotic medications are essential for managing serious mental health conditions like schizophrenia and bipolar disorder. However, when mixed with alcohol, these medications can trigger a cascade of events that can lead to life-threatening conditions like neuroleptic malignant syndrome or NMS and rhabdomyolysis. The human body is not designed to process large amounts of different substances simultaneously, and doing so can overwhelm our organs and systems. The consequences can range from mild discomfort to serious, even fatal medical emergencies. The story of one 22-year-old male highlights the potential dangers of mixing alcohol and antipsychotics, serving as a stark reminder of the importance of responsible medication use and the potentially life-altering consequences of ignoring medical advice. A 22-year-old male, let's call him Alex, found himself facing a medical nightmare after consuming alcohol while on prescribed antipsychotic medication. Alex had been diagnosed with bipolar disorder and relied on a combination of lithium, olanzapine and aripiprazole to manage his condition. While on a cruise with friends, Alex made the ill-fated decision to drink alcohol, unaware of the potential for a dangerous interaction with his medication. Soon after consuming alcohol, Alex began experiencing alarming symptoms. He became disoriented and confused, his speech slurred, and he had difficulty controlling his movements. Concerned friends noticed his erratic behavior and alerted the ship's medical team. As his condition worsened, Alex developed a high fever. His heart raced and his blood pressure soared. Recognizing the severity of his condition, the medical team suspected a possible interaction between his medication and alcohol and immediately transported him to the nearest hospital for emergency care. At the hospital, blood tests revealed a terrifying reality. Alex's creatine kinase, or CK levels, an indicator of muscle damage, were dangerously elevated, exceeding 112,000 units per litre, significantly higher than the normal range of 24 to 198 units per litre. This finding, along with the presence of myoglobin in his urine, confirmed a diagnosis of rhabdomyolysis, a serious condition involving the breakdown of muscle tissue. Further investigation into his symptoms and medical history led doctors to suspect neuroleptic malignant syndrome, a rare but life-threatening reaction to antipsychotic medications. Faced with a complex and rapidly deteriorating medical situation, the medical team worked quickly to stabilize Alex's condition. The first step was to address the immediate threat posed by his sky-high CK levels and the presence of myoglobin in his urine. These findings indicated that his muscles were breaking down at an alarming rate, flooding his bloodstream with harmful substances that could potentially damage his kidneys. To counteract this, doctors immediately started him on aggressive intravenous fluid therapy. This involved administering large volumes of fluids directly into his bloodstream to dilute the harmful substances and protect his kidneys from further damage. Simultaneously, the medical team addressed their suspicions of NMS. Recognizing that his recent alcohol consumption might have triggered this rare reaction, they immediately discontinued his antipsychotic medications. NMS is a medical emergency that requires prompt and aggressive treatment. Delaying treatment can lead to permanent organ damage and even death. The combination of aggressive IV fluids and discontinuation of his antipsychotic medications was the most critical intervention at that moment. The medical team closely monitored Alex's vital signs, urine output and CK levels, hoping to see signs of improvement. In the meantime, they continued to investigate his case, working diligently to understand the complex interplay of factors that had led to his life-threatening condition. Neuroleptic malignant syndrome, or NMS, is a rare but life-threatening reaction that can occur in individuals taking antipsychotic medications. It is characterized by a constellation of symptoms, including high fever, muscle rigidity, altered mental status, and autonomic instability, which refers to dysfunction of the involuntary nervous system that controls bodily functions like heart rate, blood pressure, and temperature regulation. While the exact cause of NMS is still not fully understood, it is believed to involve the disruption of dopamine activity in the brain. Dopamine is a neurotransmitter that plays a crucial role in regulating mood, movement, and other essential functions. Antipsychotic medications work by blocking dopamine receptors in the brain, which can help manage the symptoms of psychosis, but may also increase the risk of developing NMS, particularly when combined with other substances that affect dopamine levels, such as alcohol. The symptoms of NMS can be varied and often mimic other conditions, making it challenging to diagnose. Early recognition and treatment are crucial to improving outcomes and reducing the risk of serious complications. Section 5. Rhabdomyolysis, the breakdown of muscle tissue. Rhabdomyolysis, as we saw in Alex's case, is a serious medical condition involving the breakdown of skeletal muscle tissue. This breakdown releases various substances into the bloodstream, including a protein called myoglobin. Myoglobin is normally found in muscle tissue and helps transport oxygen. However, when it is released into the bloodstream in large quantities, it can overwhelm the kidney's filtration system, potentially leading to acute kidney injury or AKI. A wide range of factors can cause rhabdomyolysis, including trauma. Crush injuries, burns, and other forms of significant trauma can damage muscle tissue directly, leading to rhabdomyolysis. Certain medications, including statins, antipsychotics, and some antibiotics, have been linked to rhabdomyolysis. Alcohol and drug abuse, especially excessive alcohol consumption and the use of illicit drugs like stimulants such as cocaine and amphetamines, can also trigger rhabdomyolysis. Extreme physical exertion, like engaging in prolonged or intense physical activity without adequate hydration, can also lead to muscle breakdown and rhabdomyolysis. Lastly, genetic conditions, certain inherited muscle disorders, can increase an individual's susceptibility to rhabdomyolysis. The symptoms of rhabdomyolysis can vary depending on the severity of the condition. Some individuals may experience mild symptoms like muscle pain, weakness, and dark urine, while others may develop more severe complications like acute kidney injury, heart problems, and electrolyte imbalances. When it comes to neurological conditions, it's crucial to understand the factors that can exacerbate the situation. Stress, poor diet, and lack of sleep can all contribute to worsening symptoms. By addressing these elements, we can help manage the condition more effectively. Early detection and treatment are key in managing neurological disorders. Identifying the symptoms early on can lead to better outcomes and improved quality of life. It's important to seek medical advice as soon as you notice any unusual signs. Prevention is always better than cure. By maintaining a healthy lifestyle and staying vigilant about changes in your health, you can reduce the risk of a medical crisis. Regular checkups and following your doctor's advice can make a significant difference. Understanding your condition empowers you to take control of your health. Educate yourself about the symptoms, treatments, and lifestyle changes that can help you manage your condition effectively. Remember, knowledge is power.